Time now for part 4 of our series, Fight the Bite. We're looking at the Zika virus and the impact it could have on the Gulf Coast. We ran an exclusive News 5 poll this week, and 85% of registered voters in Mobile and Baldwin counties told us that they are either very or somewhat concerned about Zika. But who is most at risk? News 5's Bill Riles speaks with the local medical professionals.
Ms. Harris.
As a pregnant woman, there are a number of things that concern Tammy Harris.
Feel the top of the baby all the way down.
As a nurse, she hears about all of them.
Probably gestational diabetes, low birth rate babies.
Add the Zika virus to the list. Pregnant women and their unborn infants face the biggest trouble if they become infected.
The smaller heads, problems with eye, brain, and ear abnormalities, things like that, which has been associated with Zika virus.
Microcephaly, the abnormal development of the brain and skull of infants, is the most stark result that's been associated with the Zika virus. The heads are smaller because the brain inside did not develop properly.
Unfortunately, once that problem is identified on an ultrasound, we don't really know how to fix it.
In the absence of a direct infection by a mosquito in the U.S., the cases reported here happened after someone traveled to areas where there is an outbreak, Puerto Rico or Brazil, for example. So people who travel to those areas are at further risk. What is also known is that Zika can be sexually transmitted and can stay in the system of men for much longer, perhaps as much as 4 months.
And so if someone has traveled to a Zika endemic area and is trying to conceive, it's recommended that men should wait a few months after they come back, especially if they have symptoms or have been found to be carrying Zika.
But how do you know if you've been infected? The Centers for Disease Control say many people may have no symptoms at all. Others could develop a rash, joint or muscle pain, a headache and conjunctivitis, or red eyes. Those symptoms can last a few days or a week.
There are some troubling things about the Zika virus. First of all, there's no quick test to determine just who has it, particularly if pregnant women have it.
This is not a matter of going to the doctor and he draws your blood and in 15 minutes, like they can do with some other tests.
Potential cases now have to reach a certain criteria, then blood of suspected patients is shipped to the CDC for testing. So far, only one blood sample has been shipped for Mobile County,
which was submitted April 28th. We might hear something back by June 2nd.
So far, 3 cases have been reported in Alabama. The states with the most confirmed cases: Florida with 103, New York with 98, California with 40, and Texas with 32. All of those states with major airport hubs. Another challenge: there is no vaccine for the Zika virus. Developing a vaccine is one of the reasons the president has asked Congress for more than $1 billion in the fight against Zika. And even with funding, it will still take
years.
Yeah, literally years.
Years.
Well, the challenge with developing a vaccine for Zika is having to make one that is both effective and safe for pregnant women and their unborn infants. And that could likely take even longer than a vaccine made for everybody else. Bill Riles, News 5.